I just get a blank every time I talk. Because what I want to say is that
we're going to have an explosion, a virtual epidemic of people developing this disease, and we as a society are woefully underprepared for this. We are not ready for this tidal wave.
We come across people all the time who are very frustrated with what's happening within the medical community and just not being prepared to diagnose and deal with the disease.
And be sure to give me all of the words that you recall each time.
Yeah. Oftentimes it may be dismissed, unfortunately, as just being age, when in fact it's really something more significant that needs to be analyzed and diagnosed.
when they told me, well, you have Alzheimer's, I said, well, great, because I thought I was, going crazy.
The type of care that is required really depends on the stage of the disease.
Well, I can't drive anymore. I have problems with...
When a person develops dementia, functions that they used to enjoy are gradually eroded over time. And that requires their family members and loved ones and the community of support around them to constantly be sort of shifting up the level of support that's provided. And you're independent with respect to your ability to dress yourself.
Oh, yes.
All of those things. Mm-hmm. And how are your spirits doing? Is this depressing you? Does it make you anxious? Or do you feel pretty even
really.
keeled?
I just take it. I mean, there's not much I can do about it, so.
The real idea for creating a multidisciplinary memory care program was to get us all under one roof so that we could collaborate more readily and have closer cross-referral to one another. We have a neurologist, a psychiatrist, a geriatrician, a social worker, a neuropsychologist, a marriage and family therapist, also wonderful nurse practitioners.
It is estimated that for every one person with the disease, there are 3 people that are providing care. That translates here in our area to about 100,000 people, 25,000 people with the disease, and about 75,000 people taking care of those people.
Our whole philosophy is to work really closely with the referring MDs and to sort of think of the patient's primary medical home with their doctor and us as a room in that home.
Be aware of the fact that we have this advantage here in Rochester, and to take advantage of what the university's Memory Disorders Clinic has to offer.
How are you doing?
Being involved in research, we have access to, for example, clinical trials and novel therapies that aren't available to the general population or the general clinics.
These treatments, as opposed to the ones that are available right now, target the underpinning of the disease, the process that causes the disease.
Many of the new drugs that are out there have been developed and tested on individuals that have participated in clinical trials here at the University of Rochester. And this clinic is a model of taking translational medicine all the way from bench to bedside, and then taking it also then further into the family and the community.